Hello and welcome. You're listening to the Sickle Cell Action Network, a weekly internet radio show presented by Martin Center Sickle Cell Initiative and sponsored by Mass Therapeutics. We're coming to you live from Indianapolis, Indiana, and we're here to serve you by providing up-to-date information and opinion on all matters pertaining to sickle cell disease. My name is Gary A. Gibson, and I am your host for the next 2 hours. Let me start by saying that I don't have sickle cell disease, nor do I carry the sickle cell trait. In spite of that, I am no stranger to sickle cell. Quite the contrary. You see, even though I don't have sickle cell, it has had a very huge impact on my life. That's true because its complications took my wife from me after 12 years of marriage. It also caused her to have a miscarriage that resulted in the loss of our twin babies that she was carrying while in a sickle cell crisis. So all told, sickle cell has taken 3 lives from me, and I feel the pain of those losses every single day. I currently serve as the president and CEO of Martin Center Sickle Cell Initiative, a community-based organization that has been serving people with sickle cell for over 45 years. Each day I attempt to transform the pain of my losses into positive energy that is focused on making a difference for those who are battling sickle cell. From being involved with sickle cell for over 40 years, I'm able to say that much progress has been made, but there is still so much work to do. This show is an opportunity to contribute to the ever-expanding dialogue about sickle cell that is taking place all around the world. Our show is about raising awareness, but it is also about so much more. I like to say that sickle cell awareness is important, but we need more than awareness. Those living with sickle cell are already aware. That makes me ask, so what are we doing for them? My answer is, not enough. That's why we've named the show the Sickle Cell Action Network, because awareness without action has very little impact. We want this show to be a source of information and a call to action to help those who must live with sickle cell in their midst. We have designed this show to provide information that is beneficial to patients, caregivers, family members, and friends alike. Most importantly, we want people with sickle cell to know and understand that they are not alone. The Sickle Cell Action Network features live guests who are healthcare providers, patients, advocates, and others who are engaged in the fight to eradicate sickle cell and ease its burden on those it affects. Today, we're honored to have a special guest who will speak with us about her research on sickle cell trait. Joining me by phone today is Dr. Tilicia Mayo-Gamble. Dr. Mayo-Gamble works at the Meharry Vanderbilt Alliance in Nashville, Tennessee. We're happy to have her on the show today. Before we get to today's topics, however, I want to share some of our upcoming topics with you so that you'll know what we're going to be doing. In future weeks, we will cover such topics as sickle cell research update, traveling with sickle cell, connecting the sickle cell community, and many, many others. So as you can see, we are serious about sharing valuable information, and we hope that you will join us every week, same time, same station. If you've missed some of our previous editions or wish that you could listen to them again, don't worry. Just go to the Martin Center Sickle Cell Initiative YouTube page, and you'll find them there. Now let's get on with our show, and we'll start with this week's edition of Sickle Cell News Update. Selected a few different stories for you today. The first one is coming to us from Tanzania in Africa, and the headline of this story says, "Uncertainty looms over sickle cell care." And the article reads, "Uncertainty surrounds treatment for sickle cell disease patients at the Muhimbili National Hospital in Dar es Salaam following the end of a 10-year Wellcome Trust research program at the country's leading medical institution. Parents and guardians of children with sickle cell claim that they were not informed in time of the end of the program, only to be forced to pay for the service when they turned up for their usual clinic appointments. Some of the patients who had traveled to Dar es Salaam from as far as Tabora region and Rufiji in Coast region were referred to regional hospitals in Dar es Salaam, Temeke, and Amana, where they were also offered deferred to a later date without receiving any treatments. The program had 6,000 patients, most of them children accompanied by their parents coming from different regions in the country, some of who are forced to stay in the city waiting for their appointment dates. The MNH Acting Director General, Professor Lawrence Musero, told reporters that when the program ended on March 31st this year, the sickle cell patients were put back to the normal system, while those who will not need the nation's hospital expertise will receive treatment in hospitals near them. Professor Musero confirmed that there was a research program that required all sickle cell patients to go to the MNH for research and treatment purposes, noting that this resulted in many SCD patients going to the National Hospital even when most of them did not need the hospital's expertise. We would like the society to recall that even before the program, MNH still provided health services to sickle cell patients referred to the National Hospital. Those claiming that the MNH has stopped providing the services have their own vested interests, Professor Musero noted. As Professor Musero provided that in clarification earlier in the day, SCD activist and a parent of a child with the disease, Ms. Yasmin Razak, said parents and guardians of sickle cell patients were not informed earlier that the program had ended, leaving many parents stranded as they were unable to pay for the health services as required by the MNH. Ms. Razak said November last year the MNH were informed of the end of the program in March and told to look for ways to provide the service to sickle cell patients, but no response was provided. She said the program provided free health service to 6,000 patients while paying $2,000 United States dollars monthly as rental fee of a building to MNH. Welcome Trust was providing that funding, and they had asked to use the building for free, but they could use the money so that they could use the money to provide health service to sickle cell patients, but the MNH had refused, she charged. According to Ms. Razak, she contacted relevant authorities, including the then MNH Acting Director General, Dar es Salaam Regional Commissioner, who was not aware of the issue, and directed her to contact the regional medical officer, but nothing came of it, so she says. So there's a little bit of trouble there happening in Tanzania. There was some support for free treatment services that were provided because of a grant from a particular organization, and that grant ran out, and now there are people not sure where they're going to get their treatments. That's in Africa. And in India, from Mumbai, an article in the Indian Express says Mumbai sickle cell disease spreads amid lack of funds and awareness. So around 125 kilometers from Mumbai, a family among the Warli tribes of Valwanda village suffers sickle cell disease through heredity. While they battle constant body ache and fatigue because of the ailment, this family, the Bashkars, do not know the name of the disease or even understand much about it. Pramila Bhaskar, who is 22, only knows that it is a blood disease. She has been suffering from it since birth, but came to know of it in 2010. Her sister and mother suffer from sickle cell too, and so does her 7-year-old daughter. Bhaskar's 6-month-old son is yet to be tested. As the local public health center seldom stocks folic acid tablets needed to treat sickle cell, she travels an hour to another public health center for her monthly stock. With poor government intervention, Bhaskar's story is identical to that of several other tribals who suffer from the disease in isolated pockets and await proper treatment. Meanwhile, the state's budget for the sickle cell disease program remains stuck since last year, affecting awareness campaigns, screening, and treatment of the disease. In Palgar, for instance, there is no counselor to guide 458 sufferers and 4,887 carriers. Sickle cell, which is transmitted from parents to child, can be avoided if two patients called sufferers do not marry each other. In close-knit tribal communities where knowledge of this is absent, the disease continues to spread. Across Maharashtra, from 4 patients diagnosed with the disease in 2008 to 2009, the count rose to 2,192 in 2014-2015, according to state figures. According to a state government resolution dated March 10, 2015, free state transport bus travel is offered to sickle cell patients for treatment under the state's national health mission. However, no such provision exists on ground. So, according to Dr. Abhay Dixit, state coordinator for sickle cell, the free travel provision has not been implemented owing to delay in sanction of funds by the Tribal Health and Social Justice Department. A little bit of problems there in Mumbai and India as well when it comes to getting proper funding in place for people that have sickle cell disease. And our last story today is a better story. It's a feel-good story, and this one comes to us from Tupelo, Mississippi, and the headline is Make-A-Wish Helps Second Grader with Sickle Cell Get a Surprise Princess Day. And the article reads, 7-year-old Anaya Buchanan was welcomed to a pleasant surprise Thursday. Buchanan has sickle cell, and she receives a chronic blood transfusion every 4 weeks. But Thursday was no doctor visit for her. It's a joy for her, Anaya's mother, Sonia Carruthers, cried. Students at Tupelo Christian Preparatory School walked her door to door, looking for clues to lead her to her big surprise. Your final clue, give him a kiss and your wish is sure to come true, Buchanan read. After picking up a few more clues, Anaya had no idea what else would be in store for her. With boys dressed in their slacks and ties and girls wearing their glittery gowns, Anaya was given her own homecoming dance. Students danced around the gym, and Anaya received plenty of gifts to show off. But what she wasn't expecting was her big reveal that she was going to Disney. Are you excited? She was asked. Yes. What do you want to do in Disney? She was asked. She said, take a picture with the characters and have fun. Anaya will have to complete blood transfusions for the rest of her life, but her Princess Day is something she and her family will not forget. Her mother says, she is my angel. I'm very happy for her. That's our story from Tupelo, and another great story with Make-A-Wish making somebody's life a little more fun. Thank you to Make-A-Wish for what you do. We are going to take a break, and when we come back, we will start talking with Dr. Tilicia Mayo-Gamble about sickle cell trait and the research that she did with it. This is the Sickle Cell Action Network, and I am your host, Gary A. Gibson, and we will return. I am honored that today we have Ms. or Dr. Tilicia Mayo-Gamble, and that is Mayo-Gamble. Welcome to the Sickle Cell Action Network, Dr. Mayo-Gamble.
Thank you. Thank you for having me. It's a pleasure to be here.
Great. So the first thing that I always do with my guests is I want them to tell us a little bit about themselves so that those that are listening can know a little bit about you so they know who they're listening to. So I always ask these questions, and the first question is, where were you born? Where do you live now? And what do you do for a living?
I am from Gary, Indiana, born and raised in Gary, Indiana. I'm the oldest of 4 children, 3 girls and then 1 boy. Let's see, I left Gary in 2003 when I went to pursue my undergrad at Butler University in Indianapolis. And I graduated in 2006 and went on to work for the Marion County Public Health Department. While I was there, I worked on my master's in communication, and then after taking a few health communications courses, I decided to pursue my MPH, or my master's in public health and social and behavioral science. And then once completing that master's degree, I actually left Indianapolis to go to Bloomington to pursue my PhD in health behavior. So technically, I am trained as a behavioral scientist. And after completing my PhD this past fall, I moved to Nashville, Tennessee to pursue a postdoctoral fellowship. So right now I am a postdoctoral research associate for the Meharry Vanderbilt Alliance, which is a partnership between Meharry Medical College and Vanderbilt University, and I am placed on the Meharry campus. And basically, this fellowship is in community engagement research. So right now I'm getting training in how to include patients and community members as partners in the research that I'm currently pursuing.
Wow, that's a whole lot there, Tilicia. So what are you planning to do next?
Well, my next step is to join the faculty at Meharry.
Okay.
Currently, I'm working with the Sickle Cell Center at Meharry Medical College, and so I will be faculty as a part of that center. And so I'm going to continue my sickle cell research there, but I'll be working as a full-time professor.
Okay. So you were a presenter at the recent 2016 Indiana Sickle Cell Conference, and you gave a presentation about the findings of your research on sickle cell trait. I want us to talk about your research in detail, but first I'd like to ask you a couple of more questions. And one of those questions is, why this? Why did you choose to conduct this research on sickle cell trait? What motivated you?
I love this question because I don't feel like there's enough research being done in sickle cell trait. So I'm going to give you the background story. I actually first really learned about sickle cell disease while at Butler University, where another college student was there. She was actually from Gary, where I was from, and she had sickle cell disease. So she kind of opened my eyes to the world of sickle cell. But it didn't really personally impact me until I met my now husband, who has a sickle cell disorder. I always say sickle cell disorder because I want people to become more educated and versed in what sickle cell trait actually means and what the implications are for having sickle cell disease, which is actually the umbrella for several different sickle cell disorders. So that's the major point that I like to get across.
Right.
So it was with my husband that I kind of began my journey into the world of sickle cell disease, but it's more of my personal struggle, if you will, to find out my own sickle cell trait status. And so that's where I ended up developing this interest into sickle cell trait.
So go ahead. Go ahead.
I was going to say, through conversations with my husband, he encouraged me to learn my trait status. And how do you go about learning something like that? I think I did what typically anyone who's trying to find out about their health and something that they were born with would go to their parents. And so I went to my mom and I asked her if she knew anything about my sickle cell trait results from birth. And she said, no, you don't have it. They would have told me if you had it before because they screened for it at birth. So she said no, but I wanted to confirm this. So I actually called the local health department in Gary, Indiana, and they said that they would not have had those results. It would have been the OB that delivered me that would have had the results. So I'm going about this process of making phone calls without getting any answers. And then later, I realized that I was born in May 1985. Indiana did not start screening for sickle cell disease until July 1985. So one of the reasons that, even if I had sickle cell trait, my mother would not have known because I was born prior to the screening in that state.
Right. Wow.
So the next step for me was to figure out how I could find out my trait status. So I made some calls. I said, what exactly do you do if you need to know and there's no record of it? Is that you need to go to your primary care physician and ask them to provide the test. And so that was my first step. I found out that I did not have sickle cell trait, which is great. And then later on, I had the conversation with my husband. He said, well, you don't just need to know if you have the X trait. You need to know if you have beta thalassemia trait as well. And I said, well, why do I need to know that? He said, because I actually have sickle cell beta thalassemia. I don't have SS. So that for me, as someone who thinks of myself as being very well educated, was having just these huge obstacles in finding my trait status. And I thought to myself, well, how does the average person go about this process of finding out? It's really not cut and dry. It's not that simple. It's actually more difficult than one may think.
Well, okay. So before your encounter with your colleague, your student friend at Butler University, did you know anything about sickle cell?
I knew two things about sickle cell. I knew that there was a sickle cell center in Gary. I recall seeing the building as a child, but I never really knew what it was. And then later on, I knew that T-Boz of TLC said that she had it. And that was about the extent of it.
Okay. So you knew of it, but you didn't know about it.
Correct.
Okay. So then let's talk about the research. What period of time did you conduct your research? So when did you start and when did you finish?
So the study that I discussed at the conference, I actually collected data from March 2015 through May 2015, so about 2 months. But I actually conducted preliminary data kind of to build up the knowledge base and sift through the literature to support my reasoning for conducting this research study. So that preliminary data period was from February to March, so a little over a month in 2014. And that was just to gain the perspective of providers and educators in the area of sickle cell and then sickle cell trait screening.
And before you started your research, Tilicia, did you have any preconceived notions about what you might eventually find? And if so, please explain that.
I didn't have, I wouldn't say preconceived notions. I just expected that there wouldn't be a lot of people that knew about sickle cell trait. I felt like they might have been just like me, someone who had heard of sickle cell disease and maybe knew that someone had it, but maybe they weren't that close to that person. And so the information that they might have been receiving was kind of here and there in bits and pieces. But I really didn't know what to expect, to be quite honest.
Okay, good. I think that this subject matter is extremely important because, as you said, there isn't a whole lot known about it. And
Right.
trait, especially when it comes to some of the attitudes that people have about it as well. So you studied these attitudes in your research, didn't you?
Yes, I did.
And what did you find?
So I actually found that people were very positive about sickle cell trait screening and learning their trait status. So that's great. So they see that there's a benefit to it. I was actually surprised to learn that they felt like there was a benefit to screening because it was in ways that I had never expected. And I'll give you an example. In terms
please.
of the benefit, people actually said that getting screened, whether they had sickle cell trait or not, would allow them to get ahead of what was maybe to come either for them or for their children, and that it was beneficial to their overall health to know their trait status. The other piece to that is there were positive attitudes about it, but there were some pieces in there that I was actually more saddened, if you will, to find. For example, there was a little bit of confusion between what it means to have trait and what it means to have disease.
Right.
I felt like people wouldn't have a lot of education and awareness of trait, but I definitely did not expect for them to answer knowledge questions about trait as if they were talking about disease. And so I asked them about their feelings towards trait, but some of the responses I received said sickle cell trait means death. And about 3% of the individuals who participated in this research study said that. And I never expected that anyone would ever tell me that sickle cell was associated with death, that it meant that you were sick, it meant that you had a disease, and more specifically, it was a disease that occurred in Black people.
There was a time a couple of years ago, I know, because Martin Center Sickle Cell Initiative also does newborn screening follow-up, and our staff member that was doing the work at the time actually contacted a family to inform them that the results of their newborn screening indicated that they did have sickle cell trait, and the mother who she spoke with just started breaking into tears and crying hysterically because she thought it meant death, just like you just said. So what you're saying is valid, and we know that we've got examples of that. So before we take a break here, I want to ask you another question. How many people do have sickle cell trait in America? Is that number as loose as it is when it comes to estimating how many people have sickle cell disease?
Yes. So you'll find that references will state that sometimes there's 2 million people and sometimes there's 3 million people.
Yeah.
But what I want people to understand is the newborn screening at birth for sickle cell disease, while it identifies if you have trait, that's actually not the purpose of the screening. The purpose of the screening is look for to look for disease and not carrier status.
Correct.
So over the years, as they've done this screening and started to develop a registry for those with disease, most of the results were discarded for traits. If the parents were actually informed that their child had traits, that was, we can kind of ask parents. But other than that, there really wasn't a way to track who actually had traits, because that's not the purpose of screening. So some of the references will say 2 million, some of them will say 3 million, and that's fine as a starting point, but we've really got to get to the point where we're able to develop a registry that's for trait as well as for disease. But I will let you know that over 100 million people worldwide have sickle cell trait.
Over 100 million people worldwide have sickle cell trait.
Yes. Yes.
Wow. All right. Well, we're going to take a break here, and we're going to continue speaking with Dr. Tilicia Mayo-Gamble. This is the Sickle Cell Action Network Internet Radio Show, and we will be back shortly. Welcome back to the Sickle Cell Action Network, and this is Gary A. Gibson, your host, and on the phone with us today is Dr. Tilicia Mayo-Gamble, calling in from Nashville, Tennessee. Dr. Mayo-Gamble works with the Meharry Vanderbilt Alliance and has done some pretty extensive research on sickle cell trait, and we are speaking to her about her research, and we will before we pick up where we left off, we're going to go backwards just a little bit, and we want to go back to a question I asked her before the break, and that question was, did you have any preconceived notions about what you might find when you started your research? And I think maybe there is something you want to say. So, Dr. Yes.
Well, I started out really wanting to get information on how much people knew about sickle cell trait and the process of getting screened. So I actually asked open-ended questions to allow individuals to sort of give me their own definition. I asked, what does sickle cell trait mean to you, and what does sickle cell trait screening mean to you? And so going in, I assumed that everyone would just provide a definition, whether accurate or inaccurate, so that I can sort of come up with a percentage of how many people knew what sickle cell trait indeed was. Okay. What I found was that instead of, some people did define it, but instead of defining those terms, some of the participants actually told me their personal experiences with sickle cell trait, or what they thought was sickle cell disease as well. So I was really surprised to find that some people said that it was a hurtful feeling, or that their brother had it. Some people said a parent had it. So that was something that I didn't expect to find. I think there's further research needed in this area, not just to understand the definition and a yes or no answer in terms of whether or not individuals accurately understand what it means to have traits, but also to understand how sickle cell trait and not just disease impacts our lives.
Okay. All right. So how many people, where did you conduct your research?
I conducted my research in 3 cities throughout the state of Indiana. I did Gary. I started out, I should say, initially with the states that had the highest populations of sickle cell disease and sickle cell trait, according to information received from the Indiana State Department of Health. And so those cities were Gary, Indianapolis, and Fort Wayne. However, I knew that my resources were not going to allow me to go back and forth to Fort Wayne. So I started out working in Gary, Indiana, which I was pleased to work there because that's where I'm from, so it was an opportunity to give back. Indianapolis, which I stayed as my second home and home to my husband. And I actually added Bloomington, Indiana, specifically because, number one, I was there, so it was convenient, but also it gave me an opportunity to have access to athletes, which is right now.
Okay.
Yeah. it's one of the biggest issues related to sickle cell trait right now. So I got an opportunity to include some of them in the study.
You know, I don't remember his name, but I believe that in the NFL draft, just this past couple days, there was a athlete and a football player that was drafted that does have sickle cell trait, and there was some story that I read about how a couple of the teams passed him over because they knew he had sickle cell trait and they didn't want to deal with that.
Right. That's actually one of the stigmas. There's a lot of stigma that you hear associated with sickle cell disease, but now we're starting to see stigma associated with sickle cell trait because people are now becoming aware that the athletes have it, and so their carrier status is publicly known, unfortunately, for the athlete.
Right. Tilicia, how many people did you study, and what were their age groups?
I included 300 African American men and women in the study, and they were range ages 18 to 35 years. That's what we call a middle reproductive age. So I wanted to focus on a group of individuals who either had a child and were planning to have another child currently or in the near future, and then individuals who had not had children who may want children in the future.
Did you notice any differences in their responses or the way that they responded between those different age groups?
Yeah, actually, because I was looking to measure their intention to actually get the screening, I actually noticed differences in their intention.
Okay.
So individuals who were closer to the younger ages, so like 18, 19, 20, they were actually less likely to want to go and get the screening done for sickle cell trait. So those who were closer to the age of 30 had much higher scores of intention, meaning it was something that they were ready to do, specifically because they were actually thinking about having children or knew that it could impact their decision to have children.
So
but right now, I think
those
the younger age...
Those that were younger, you said that those that were younger had less intention than those that were older? Is that what you said?
Correct.
Okay, go ahead.
Yeah. So initially our thoughts were that it was due to just them wanting to have children. But another explanation could be that those who were younger were classified as students. And so as students, it might be that you have less access to insurance or less access to a doctor who's able to perform the screening test. Especially if you're on the campus, it's not always the case that you can go into the campus clinic and request sickle cell trait screening.
I've seen a statistic for this question, and maybe you have too, but what percentage of the people that have sickle cell trait are unaware that they have it? Do you know?
I don't know. I'm actually surprised that you were able to find a statistic.
I have. I'm just not sure where it is. I can't find it, but I've seen it in the past.
I would be curious to know how they actually determine that. Specifically, kind of going back to what I said before, I guess maybe you could go back and look at the number of screenings that were done in the past, and then those who could have possibly been screened positive, if you consider the number of individuals who actually have sickle cell trait within the U.S. Maybe there's some way to go backwards and include that in a registry. So maybe they're getting the statistics that way. Yeah. I will say one of the reasons why, you may have come across one statistic but not several statistics, is because universal screening, even for sickle cell disease, just became universal to all states within the U.S. in 2006.
Right.
So people are actually not just finding out whether or not they have sickle cell trait. Some of them are just now finding out that they have sickle cell disease.
Yeah, right. Huh. Those that are motivated to find out if they carry sickle cell trait do sometimes encounter obstacles that hamper their ability to actually get tested. So they just put it off until some other time. And that can actually be a bad decision sometimes, I think. So
Right.
what I think your research probably showed you, what are some of these obstacles that people encounter when it comes to, so let's say they've got the intention, yeah, I want to get screened, and then they don't get screened because of these obstacles. What are some of these obstacles that people run into?
So the first obstacle is the issue of having to be screened by your healthcare provider or having them to run the lab test. So there are a lot of things, and this is why I know we haven't discussed this within this conversation, but the specific behavior that I looked at was intention to go to your doctor to ask for sickle cell trait screening. So this isn't a test that you can do on your own. You actually have to schedule the doctor's appointment, get yourself to the doctor, pay for a copay, have the conversation with your doctor, have the doctor order the lab, go to the lab, have the blood drawn, be prepared to get the results. So there are a lot of little steps in there that we tend to forget about. So there are challenges in terms of getting to your doctor's appointment. So some people have transportation issues. Some of the individuals within the study did not have a healthcare provider.
Right.
And assuming that they did have a healthcare provider and were able to schedule the appointment, they may not have had insurance.
Right.
Which means that they would have had to pay out-of-pocket costs in order to cover the test. So the next issue is their perceived risk. And it's going to go a little bit into some of the factors, if you will, that I looked at in my study, and that is whether or not they perceive that they were susceptible to having sickle cell trait. So those who just didn't know anything about it were more likely to intend to go and get the screening done. But those who felt like no one in their family had discussed sickle cell disease or sickle cell trait, and they didn't know anyone with sickle cell trait or sickle cell disease, and they didn't know much about it, basically thought that they weren't at risk for having it, so there was actually no reason to go and get screened.
Right. Right. And that's a matter of education.
Right.
Yeah.
Right. Which is one of the issues there. It's not just textbook education, but it's lay education as well. So having these discussions.
Oh, we have lost Dr. Mayo-Gamble, and we are going to try to get her back. We're going to take a break here, and when we come back, I'm certain we'll have Dr. Mayo-Gamble so that we can continue our discussion. I'm not sure what happened with our connection, but we will be back. Hold on. Action Network is sponsored by Mass Therapeutics, a publicly traded biopharmaceutical company headquartered in San Diego, California. MAST is currently leveraging the molecular adhesion and sealant technology platform derived from over 2 decades of clinical, non-clinical, and manufacturing experience with purified and non-purified pelaxamers. MAST has developed a drug called MST-188 as a candidate for serious or life-threatening diseases with significant unmet needs. Among those needs is the treatment of sickle cell disease. MAST has enrolled sickle cell patients in a clinical trial known as EPIC. EPIC stands for Evaluation of Purified Pelaxamer in Crisis. If successful, EPIC could result in the first treatment of its kind to treat sickle cell disease patients while they are in crisis. The EPIC study aims to determine whether MST-188 can shorten the duration of a painful crisis. MST-188 is an investigational drug that has not been approved for commercial sale in any jurisdiction for any use. MST-188 potentially improves oxygen delivery, and it may help keep blood vessels from becoming blocked and more obstructed. It may improve blood flow by stopping cells from grouping together. It may also reduce inflammation, and it may restore cell membranes and give damaged cells time to heal. EPIC participants continue to receive their normal pain treatments during crisis, and their participation is free of charge to them. The patients involved in the EPIC study may not only be helping themselves, but they might also be helping future generations of those yet to be born. If you are interested in learning more about the EPIC study, please visit www.theepicstudy.com. So speaking with Dr. Tilicia Mayo-Gamble on her sickle cell trait research, and we are going to pick up where we left off. Tilicia, one of the goals of your research was wait a minute, I'm getting ahead of myself. This next question I have is, in your presentation you talked about something called fear beliefs. What are fear beliefs, and what significance do they have to your findings?
Fear beliefs are what individuals believe about the seriousness and the severity of having sickle cell trait. So I asked them a few questions to get at the factor severity. I asked them to state their level of agreement with the following two statements. Number one, I believe that sickle cell trait is severe. And then the second statement said sickle cell trait has serious negative consequences. So individuals first told me whether or not they agree with those statements. And then later on, I asked them what they believe to be the benefits and barriers to actually getting the sickle cell trait screening. And then the second set of fear beliefs included their perceptions of the susceptibility to having sickle cell trait. And one of the statements that I used to get at this factor was, I am at risk for having sickle cell trait. So individuals stated their level of agreement with that statement. And then the second statement for susceptibility was, it is possible that I could have sickle cell trait. So I actually learned that most individuals did believe that sickle cell trait is something that is severe, and they also believe that sickle cell trait has serious negative consequences. On the other side, perceived susceptibility is where I started to see some variation in the responses. So about an equal amount of individuals, so probably about 90% of the individuals believe that it's possible that they could have sickle cell trait, but they didn't think that they were at risk for having it. And it's actually, before we were cut off, that's kind of where I wanted to go with my statement, is that when families don't talk about the fact that you were screened for sickle cell trait or sickle cell disease at birth, and if they don't talk about the fact that someone in the family has had sickle cell disease, or they know that a family member has sickle cell trait, then it leads us to believe that we aren't at risk for being a carrier of sickle cell disease. And so that actually has an impact when researchers such as myself are trying to develop interventions and basically to get resources or to get grants to offer the screening. When people believe that they aren't at risk, they're not going to take advantage of those types of services, which prevents us from getting funding because grant funders think that individuals are not interested in actually getting the screening.
You know, this is an area that actually we've talked about before on this show, Tilicia, and that is that we really believe that it's important for people to share the fact that they have sickle cell disease.
Right.
And you have just hit it from a slightly different angle from what we've talked about in the past on the show. But how is someone supposed to get a sense for whether or not they are at risk if there is someone in their family that does have sickle cell disease or sickle cell trait, and those people don't let other people within the family know it? How are they supposed to feel like it's important or that they're at risk? If there is no reason to suspect it, then they don't feel like they're at risk. And if there's someone in their family that does have sickle cell disease or sickle cell trait and doesn't tell other members of their family, then they are not helping the situation, because those that don't know are at risk. Even if you don't know you're at risk, that doesn't mean you're not at risk, right?
Right. And I think that's part of the issue with having that conversation is through telling our stories, we're able to provide an explanation as to how an individual gets sickle cell disease. Just when we were at the conference a couple of weeks ago, one of the conference participants actually stated that they thought sickle cell disease was something that you catch. So if we leave the conversation at someone in your family has sickle cell disease, it's very likely that they might believe that that was something that they caught. Whether if they think that you're getting it the same way you get the flu or that you get an STI, we don't want people to get those misconceptions. So when we don't talk about the full story, people don't think that it's something that's passed on from a parent, or that if your sibling has it, that it's something that you're actually a carrier for.
So in the past, we've talked about how not talking about it can have implications such as the federal government not thinking that this is an issue because nobody talks about it, so it doesn't exist. If people don't talk about something, it doesn't exist. Well, here's another angle that says if people don't talk about it, other people who are at risk will be misled to think they aren't at risk, and that's not a good thing. So one of the goals of your research was to explore the level of understanding of sickle cell trait and sickle cell trait screening from the perspective of a high-risk population. Please talk to us about what you found out.
So to start, I'd like to define what I believe is a high-risk population. So the 300 participants in my research study were all what I call high risk, meaning that they were unaware of their trait status. So despite having someone in their family who had the disease, or they knew that someone in their family had trait, they didn't ask the question as to whether or not they had trait, and to their knowledge, they had never been screened. And if they had the screening at birth, they were not aware of what those screening results were. They were also within middle reproductive age, which means that they were also possibly at risk for having a child with sickle cell disease without prior notification of their own sickle cell trait status. And that's one of my biggest populations of interest, is individuals who are possibly at risk for having a sick child without knowing that they're at risk for having a sick child. So what I actually found, and I'll start with the way I asked the question. I'll go back. These are open-ended questions to get at individuals' understanding of sickle cell trait and sickle cell trait screening. So I started out just having them write down what they thought these two terms were, and I compared their responses to how Western science has defined sickle cell trait and sickle cell trait screening. If they matched that definition based on Western science, meaning the CDC, the Sickle Cell Disease Association of America, similar agencies such as NIH or the National Heart, Lung, and Blood Institute. And so if they matched that definition, I gave them a score of accurate. And if they partially matched it, meaning they understood that sickle cell trait meant that you were a carrier for a disease, or they might have said that you have a blood disorder, then I gave them partial credit. And then others who did not match that definition or didn't get a piece of the definition were scored as incorrect. So I found that 55% of the individuals, so approximately 150 of the participants, were incorrect. So they did not give a partially correct response. They did not give a completely accurate response.
50%?
About 50%, yes.
Okay.
And then another 29% received partial responses. So they knew that it had something to do with the blood. And then 15% of the responses were completely correct.
Only 15% were correct.
Yes.
So that shows you, folks, that there is still a lot of work to do, a lot of education that still needs to take place. You know, one of the other things that I think you might have found is that, true to form, a lot of people don't even understand that there are different types of sickle cell, different varieties. and that would apply also to the trait. So did you find anything out in that area?
Yes. So a lot of people believe that when we talk about sickle cell trait, that there's just one type of trait that forms sickle cell disease. So I have to have S trait, and the person with whom I'm having a child with has to have the S trait. And if neither of us have the S trait, then we can't have a child with sickle cell disease. And that's actually an inaccurate statement.
That is totally inaccurate.
Yes. So I'll go back to the discussion of my husband. He actually has sickle cell beta thalassemia, so he does not have SS. What makes it a little more complicated is that he has sickle cell beta thalassemia 0.
Mm-hmm.
And there is also sickle cell beta thalassemia plus. So the trait that we're looking for there is someone will pass the S trait and another person will pass the beta thalassemia trait, but it's possible that they were passed what's called the beta thalassemia minor and then the beta thalassemia plus trait. So those are two outside of the S trait that create sickle cell disease. The second most common form of sickle cell disease is sickle cell with a hemoglobin C. So they call it SC disease. So one individual passes on their S hemoglobin trait and another individual passes on their hemoglobin C trait. And then there is another form of sickle cell disease called sickle cell alpha thalassemia, which means that one individual passes the S trait and the second individual passes on an alpha trait or an alpha hemoglobin trait.
Mm-hmm.
So when you don't understand that there are different variations, we use this term sickle cell disease, but sickle cell disease is defined as sickle cell disorders, meaning there are multiple disorders within the umbrella term disease. And so when people don't realize that they're not just looking for the S trait, then they don't know, and they're oftentimes misdiagnosed. Since I've been in Nashville, I've actually come across a couple who went through with the screening. The female knew that she had S trait, and she was trying to get her husband screened, and he did, and the screening turned out negative for S trait. And the child, they actually had a baby, and the child ended up with sickle cell beta thalassemia because they did not know to ask for specific screening that would detect the beta thalassemia trait.
And that's a really, really good point that we want people to listen to, is that you really need to get specific results. And there are a variety of tests that people can take to find out whether they have sickle cell disease or sickle cell trait. Some are basically not very complete studies or not very complete tests. So you want to be sure that you are asking for the most comprehensive type of screening. If you are going to go ask for screening, you're going to ask for the most comprehensive. I want you to find out if I have any variety of sickle cell. Don't just ask because a different test will give you different results, right?
Yes, and the basic test that looks for this is the electrophoresis, which is typically what a physician or a genetic counselor might order initially if you're not looking for a specific genotype.
Right.
However, that test does not identify the alpha thalassemia trait, and so that would be one incidence in which an individual might be born with sickle cell trait or sickle cell disease because their parents got the screening and they did not look for the alpha thalassemia trait.
Right. This is good stuff. You're helping inform our audience, and you're doing a really good job of that. We are going to take another break. When we return, we will come back and continue our discussion with Dr. Tilicia Mayo-Gamble. This is the Sickle Cell Action Network, and I am Gary A. Gibson.
Hi, I'm Gary A. Gibson, your host for the Sickle Cell Action Network Internet Radio Show. If you are impacted by sickle cell disease in any way, Whether you are a patient, a caregiver, or a friend, you need to join me every Tuesday at 4 p.m. Eastern Time. I promise that you will find our show to be full of information, perspective, and opinion about all things sickle cell. See you Tuesday right here on RadioNext.tv, the Cool Groove site.
Fast Therapeutics is leading the way in developing treatments for sickle cell disease. We're proud to sponsor the Martin Center Sickle Cell Initiative in its mission to provide leadership, education, and support services to the sickle cell community.
Welcome back to the Sickle Cell Action Network. I'm Gary A. Gibson, your host. The Sickle Cell Action Network is brought to you as a service of Martin Center Sickle Cell Initiative. We are a community-based organization here in Indianapolis, Indiana, providing services to people throughout central Indiana. And we offer a food pantry, we offer transportation assistance, emergency financial assistance, support groups, and pretty much anything that we can do to try to help people cope with the rigors that come with living with sickle cell disease. In addition to the services, we also provide education throughout the community on sickle cell. We participate in 30 to 40 health fairs a year. We also advocate on behalf of those that have sickle cell. We continue to do this work because we believe in the need for the work, and we look always for help and support from those that share our concern for those that live with sickle cell disease. We're speaking with Dr. Tilicia Mayo-Gamble, and we're talking about her research on sickle cell trait, and there are some fascinating findings in her research that we've been talking about. So let's continue that discussion. Tilicia, did you find that people had difficulty in understanding the difference between sickle cell trait and sickle cell disease? And if so, were you shocked by that?
So to answer your first question, yes. And I was very shocked to find that they didn't understand the difference between sickle cell trait and sickle cell disease. This actually made analyzing the data very, very complicated. Initially, my thought was to just code individuals' responses as being incorrect if they stated as if they were speaking in regard to sickle cell disease and not answering about sickle cell trait. But then as I got through all of their responses, I realized that some of them actually thought that sickle cell trait was the same thing as sickle cell disease, and some of them were actually responding despite stating that it was an illness as the actual definition of sickle cell trait. So I was very, very surprised.
And how many people didn't have a good understanding of the role that sickle cell trait plays in producing sickle cell disease? How many people didn't understand that inheritance pattern?
So I think that kind of goes back to looking at the partially incorrect responses, so that sort of 29% of individuals who got a partially correct response in relation to sickle cell trait. I actually found that it looked like they sort of understood, but they didn't really know that there was something called the trait and then something called the disease. So looking at out of the 300 individuals that responded, 30% was probably, 30, 60, about 90 people out of the 300 didn't realize that there was a difference between sickle cell trait and sickle cell disease.
So just under 1/3 of the people didn't realize there was a difference.
Correct.
Okay, that's pretty, I don't know, scary. But anyway, how many people thought that sickle cell was an illness then?
Oh my goodness. I would put that in the category of the 50%. I would say half of the 50% that did not know, because some individuals just legitimately stated that they didn't have a clue as to what sickle cell trait was. But there was about 25% of the individuals who just thought that it was something that made you sick. They knew it wasn't the disease, but they literally thought that sickle cell trait was something that caused the actual illness. And it could be that some individuals, such as myself, who know of someone who has sickle cell trait, and they do have symptoms that have been associated with the trait.
Yeah, I was going to ask about that. And I think several times. Actually, this is our 30th show, and I think a few times we've mentioned the fact that there are people that have sickle cell trait that do seem to demonstrate some manifestations of sickle cell disease. And so I guess I'm going to ask you, did you find anybody that claimed that they actually experienced health problems?
I do. Not just anyone. I'll start with personal family members who are within my in-law side. So my husband's family, he has sickle cell disease, and many individuals within his family actually have sickle cell trait, and did not realize, this has been a learning process for them as well, didn't realize that the times that they've gotten on a plane and started not to feel well, that it could have been associated with their sickle cell trait. So it's actually caused them to have complications and to have discussions with their doctors regarding their trait status. Individuals who have diabetes and sickle cell trait will find that their A1C numbers are not normal, not as a result of the diabetes, but as a result of having the combined diabetes with sickle cell trait. I actually have a goddaughter who has sickle cell trait, and she's been having kidney issues ever since she was born, that the doctors have said is a result of her having sickle cell trait. Another complication that you'll see often is hematuria, so blood within the urine in individuals who suffer from sickle cell trait. And again, some of the common symptoms that have been linked to medical references are actually in extreme conditions. So individuals at an increase for heat stroke, or individuals who are athletes and either, like you said, the football player who may one day have to play in Denver where the altitude is high. You'll often see them sitting on the sidelines with oxygen masks to increase their blood flow so that their sickle cell trait doesn't mimic signs of sickle cell disease.
This is, I think, really important, and we believe that there does need to be a lot more research done on sickle cell trait. Now, of course, there's a lot more research needs to be done on sickle cell disease as well, and we definitely are proponents of that, but definitely because you can't have sickle cell disease without sickle cell trait, it surely makes sense for us to be able to have a much better understanding of sickle cell trait. Not only how does it transmit, but also what are the implications? How does it manifest? Does it really cause problems? And if so, why and how? And those are things that we really think need more research. And as we continue pushing for more research to take place, more funding for research, we certainly want those that do the research to not forget about understanding sickle cell trait even better than we do. So, at Martin Center Sickle Cell Initiative, we're concerned that more and more people within our region, especially immigrants and refugees, have sickle cell trait and they don't know it either. And that's because they come to us from countries where they don't screen at all. Did your study include any immigrants?
It did not include any immigrants. However, I will say that the research that I'm embarking on now will include individuals from the Latino and Hispanic community, and as a part of some of the sort of IRB or the review boards that approve the research studies have found a way to allow individuals who do not have Social Security numbers to participate within the research study. So that way we can include immigrants who are both citizens and may not be documented citizens as well. Okay, well, let me definitely put a plug in for that, because really concerned about that. I did some research myself, and I found that, with the tremendous immigration throughout the United States, a large percentage of the immigrants come from countries where sickle cell exists. In fact, in some cases, it's prevalent, and they don't screen. And so I'm convinced that there are many thousands of people that have sickle cell trait that have come in from other countries and they don't know it. And in some respects, that's a ticking time bomb.
It's a public health matter.
Right.
And this is something we're trying to push people to do. So about what percentage of people in your study even seem to show an interest in learning more about sickle cell trait?
So the way I collected the data, some individuals answered their responses online without me being present. And so I wasn't able to kind of assess that information from them, but all the individuals that I had face-to-face contact with, I'd probably say about 5 people didn't have an interest. They kind of just wanted to participate in the study. But almost everyone that I talked to the days that I was out collecting data wanted to sit down and talk to me. I actually wish that I was doing a study that was really about sitting down and talking to them about their experiences with individuals that they'd known with sickle cell disease or sickle cell trait, because they were so impactful. But mostly everyone felt as if this was a really important issue, and it was really nice for me to hear the personal stories associated with just knowing someone with the actual disease.
Well, I think, on that line, let me ask you, we haven't gone there yet, but you as the spouse of someone with sickle cell disease, sickle cell beta thalassemia, what are your impressions of that?
My husband has a very interesting case because he was not properly diagnosed until he was in his 20s. And you'll find that because he has beta thalassemia and not SS, that's actually pretty common to get misdiagnosed.
Yes.
But he was actually born prior to screening actually conducting screening in Indiana. So I've had to face a number of, not really challenges, but we've had more conversations about health than I would say the average couple, just because not only am I in research, but I am in health research, and typically wives also are responsible for scheduling their husband's doctor's appointments. So for us, our health conversations typically include identifying a hematologist. We actually just found a hematologist for him to see here in Nashville because of the move. So he had actually become accustomed to what seeing a hematologist was like in Indiana. Sometimes they were great, sometimes they were not, but it's really important for him to have a home physician that he can go to who understands his type of blood disorder. So that's one piece of it. The other piece is not only do we have to be concerned with having a hematologist, but also having a primary care physician who understands the disorder. And that's key. So that's actually something that we never really thought about. We've always gone to a primary care physician that we just liked, as opposed to having a primary care physician who's also in the same network as the hematologist, and that those two have a rapport.
Right, that's very important.
So one of the issues that individuals with sickle cell disease have faced in Nashville, and my husband and I have had these conversations with patients, is having to go to the emergency room and not having a primary care physician or a hematologist who's established a relationship with the ER. And luckily for us, it hasn't been a major issue, but I know that's one of the issues that other sickle cell patients have discussed, is number one, not having a rapport between physicians, but also not being able to relay the information adequately to the ER care and not being triaged as quickly as other patients within the ER.
Absolutely, very important. So, I think another question I'd like to ask is, so what do you think about sickle cell?
I think a lot of things about sickle cell. One of the reasons, outside of my husband, that I've stuck with this for so long is, and it's been 10 years now for me, is we do not have enough people advocating for sickle cell disease and sickle cell trait. I've stuck with sickle cell trait specifically because if you don't have someone who's actually doing research in this area, there's no way to get funding in this area. And we talk about the number of individuals who have sickle cell disease within the U.S. I know that number keeps rising. I know that the number 100,000 has been thrown around since 1972, but I know that it's more than that.
Oh, I do too.
But when we think about 3 million people within the U.S. who have sickle cell trait or who have a different trait, so the alpha thalassemia, the beta thalassemia, the hemoglobin C, that number is well over 3 million. And so when you think about 1/4 of that number of individuals who could possibly have a child with sickle cell disorder, it really means that we should be having these conversations. We should be receiving funding for it, and it's just not happening. So that's part of my passion for it. But the other thing is, sometimes I have mixed feelings about it because it's not an easy content when you're doing research. Because in the past, I've had challenges with people telling me that sickle cell trait, because I don't focus on sickle cell disorder, is not an area of research that I should go into. For one, because there's no money in it, and two, because there aren't a lot of medical references to support the need for research on sickle cell trait. Is something that they see as not really being worth my time, if you will.
Yeah, it's like I said not long ago. It's that we've got this situation where people are starting to wake up to the fact that sickle cell disease is a national health issue. And there are starting to be more and more resources dedicated to sickle cell, whether it's research, whether it's pharmaceutical development, whether it's supportive services. But the key is you can't have sickle cell without sickle cell trait. So we have to study that too. We're going to take one more break, and then when we come back, we will wrap up our conversation today with Dr. Tilicia Mayo-Gamble. This is the Sickle Cell Action Network, and I am your host, Gary A. Gibson. I am Gary A. Gibson, your host, and we are getting ready to wrap up our great conversation with Dr. Tilicia Mayo-Gamble, who has been giving us tremendous information about the research that she did on sickle cell trait. Dr. Mayo-Gamble, what are some of the implications that arise from your research?
Well, for starters, because there isn't a lot of research out there on sickle cell trait, I'm hoping that with my publications, and that's what I'm working on right now, is publishing the material from this research study. I'm hoping that there would be more attention, not just on sickle cell disease, but also on sickle cell trait. And with more attention, I can provide an opportunity to receive more grant funding. The grant funding is what's really going to allow me to make a difference, and so that's kind of where my trajectory is going. I'm actually working on collecting new preliminary data to get providers involved in relation to sickle cell trait. So it's really important that providers are at the table, and there are a few reasons for that. The first is, right now there is medical research to support not necessarily increased screening for athletes going into college, but specifically so that they can utilize universal precautions when they're going out onto the football field or soccer field, for individuals who are seeking to join the military in some capacity. Those individuals are actually being sent to a medical care provider. And so it's really going to be important for providers to be able to provide sufficient information so that an individual knows what steps they should be taking if they do spring positive. It's not a situation such as that which is going on with newborn screening. So the newborn screening is usually, there's follow-up usually done by a genetic counselor or a coordinator who's responsible for the follow-up. But with adults, it's a little different. You're actually following up with your primary care physician or some other medical provider who's having the conversation with you. And their area of expertise may not be in sickle cell, or they may not be a hematologist. So it's really going to be important for individuals outside of the area of hematology to be able to have these types of conversations. So right now, I'm actually working toward collecting data to support grant funding that will allow me to develop a provider intervention for adults who are seeking to be screened with sickle cell trait, so that we can allow the interaction between patients and providers to be more patient-centered, so that they get the information that they need to learn about different types of traits associated with sickle cell disease, what specific type of hemoglobin trait they may possess, and what their next steps should be.
Well, I agree with you, and I do believe that it's extremely important to get the providers involved. And I'll cite a recent study. We've mentioned it on the show previously, but this study found that only 20% of practicing family physicians felt comfortable treating patients with sickle cell disease. So if that's the case, then imagine just how smaller percentage of those people would feel comfortable even talking about sickle cell trait. And so this is why you're on point, and we encourage you to continue doing what you're doing, and we wish you the best of luck with that. Do you have any other thoughts that you'd like to share with us as a result of your research or otherwise?
Well, I would like to first thank you for allowing me to have a platform to speak about sickle cell trait. I'm very passionate about this process, specifically because this is my connection to the sickle cell community. And I've had people, in trying to conduct my research, to ask me, well, why are you here? Why are you sitting at the table if you don't have sickle cell disease or sickle cell trait? And it's more than just being an advocate for me. I'm someone who has gone through the process of trying to find out their status. So I stepped into this literally just being a lay individual who didn't have a lot of contact or awareness regarding sickle cell trait or sickle cell disease. And now I'm someone who can actually walk them through the process. And I think one of the things that drives me in this process is being in interactions that I've had at the Martin Center. I actually ran into a young lady who asked the question. She just kept saying it. Why didn't anyone tell me? Why didn't they tell me I was going to have a sick child? And I just don't think anyone who can know ahead of time that they are going to be responsible for passing along a trait that will cause their child to be sick to go into that blindly.
I agree. Well, we would definitely like to take this opportunity to thank you for being with us, and would like to follow, your next steps, and hopefully you will keep us informed as you move forward. We particularly want to again encourage you to continue your research, and to do so with another perspective of, let's look at those immigrants and refugees. Let's get them in this picture and see, because they are becoming a part of our community, and that's not going to stop. That's only going to continue. I go back to the study released by Dr. Frederick Peel in 2013 that said the incidence of hemoglobinopathies, particularly sickle cell disease, is increasing worldwide and will continue to do so through the year 2050. I saw another headline just yesterday that said something to the same effect about hemoglobinopathies in general are increasing in the United States. So this is something that's important, and the fact that sickle cell affects people in so many different ways, both physically, mentally, socially, occupationally, educationally, etc. This is so important, and we are making progress, but we still have so much work to do. We need people like you that can give us the kind of data. Unfortunately, I think in this world today, so much of the policy making and decision making is driven by data. And we do not have data to help people understand this problem is as important as we feel it is. And so the more data that we can have, the better off we'll be. So we encourage you to continue doing what you're doing so that you can help add data to the mix. And that data can help get more research funding, not only for what research you're doing, but for the other research that needs to happen with sickle cell trait in general. Dr. Mayo-Gamble, thank you for being with us today, and we hope to talk to you again in the future after you've completed some more research.
Thank you.
All right, ladies and gentlemen, that is Dr. Tilicia Mayo-Gamble from Nashville, Tennessee, and we're very delighted that she's been here with us. And we are going to now close out our show. As always, we do so with some closing thoughts for you. And today I'll start with a quote from Neil deGrasse Tyson, who said, "I know of no time in human history where ignorance was better than knowledge." I know of no time in human history where ignorance was better than knowledge. Neil deGrasse Tyson is an African-American astrophysicist, cosmologist, author, and science communicator. Since 1996, he has been the Frederick P. Rose Director of the Hayden Planetarium at the Rose Center for Earth and Space in New York City. He was awarded the NASA Distinguished Public Service Medal in that same year. From 2006 to 2011, he hosted the television show Nova on the PBS television network. Since 2009, he has hosted the weekly podcast Star Talk. In 2014, he hosted the television series Cosmos: A Space-Time Odyssey. One of the dumbest things I've ever heard is the saying that goes, "What you don't know can't hurt you." A good example of the stupidity of this statement is what can happen when a toddler comes upon a loaded and unprotected gun and decides to play with it. You know what happens next, and it isn't very pretty. Another example is the man and woman who both have sickle cell trait and don't know it. For each child that they produce, there will be a 25% chance that the child will have sickle cell disease. This is simply a matter of genetics, and guess what? Genetics is science, and science doesn't care about what someone does or does not know. I am constantly disturbed by the lack of knowledge that people have about sickle cell. It doesn't matter if it's the trait or the disease. Both are terribly misunderstood, and they seem to be covered in dark shadows of perpetual ignorance. With so many years gone by since sickle cell's identification, and with millions upon millions of people affected by it worldwide, it just doesn't seem right that there is still so much ignorance out there. We are talking about people's lives here, and there is nothing more important than that. I think that the only thing worse than ignorance is the lack of interest in erasing it. You would have a hard time convincing me that most people of African heritage have never heard the words sickle cell. If they've heard those words, they have most likely heard that their ethnic group is the one that is most affected, and that they are at most risk of propagating it. Still, many of these people do not even attempt to learn more. Not only do they attempt to not learn more, they don't attempt to find out if they are carrying the trait. I really don't like putting labels on people, but sometimes you just have to do it. What do you say about someone who knows that they might be at risk of carrying one of the most destructive of all human genes, and then refuses to find out if they are actually a carrier? Ignorant, that's what. You see, there are two kinds of ignorance. There is the official English language definition of ignorance, and there's the definition of ignorance as it's used in slang terms. The official definition of ignorance is lacking knowledge or awareness in general. On the street, ignorance is often substituted by the word ignorant. Ignorant means dumb and stupid. Ignorance and ignorant are not the same, but it is hard to decide which is more dangerous when it comes to sickle cell. Either way, it's time to pull the curtain on ignorance. This is obviously a big job, since so much of it still exists with regard to sickle cell. So my question for today is, what are you doing to erase the ignorance? The work of Dr. Tilicia Mayo-Gamble and others is only a part of what needs to happen. The rest of the work is on our shoulders. Let's keep working together to get rid of the ignorance so that we can make better progress in eradicating sickle cell from this planet. That's our show for today. Please join us again next week, same time, same station.